New Mexico Cancer Center and Health Specialists of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
So many men delay care in general, and so that's a big problem because a lot of the major killers, whether it's heart disease, cancer, diabetes, high blood pressure, these are all things that develop slowly over time. So the sooner that you get in to see a doctor, the better we're going to be able to treat those when they're a minor problem and not a bigger problem. So as men age, we want to screen for things that are going to kill us. So the major killers are going to be heart disease, diabetes, cancer. So all these things, we can develop screening tools to be able to help identify risk factors and help change those risk factors, whether through screening or through medication. We'll know that these things are much easier to treat and deal with when you catch them early. For most males, it's going to be important to get started with your health journey in your 30s. So making sure you're getting regular blood work to check for cholesterol, to check for diabetes, to check your blood pressure. And then once you reach your 40s, at 45, you should get a colonoscopy. At the age of 50, you should start screening for prostate cancer. And all these things can help identify problems early because you're able to intervene early and improve the long-term outcome. There's several health habits that can reduce risk for cancer and for heart disease. So sleep is one of those foundational things that we need because having 7 to 8 hours of sleep will lay the foundation. That way we're able to eat better, we're able to be more motivated to exercise, and that will have an impact on our weight. And when we decrease our weight, it decreases our risk for heart attacks, it decreases our risk for the most common cancers. The number one thing that a patient should do is to establish with the healthcare provider right away. So if I was a man, the first thing I would do is schedule an appointment because you're not going to be able to get established for another 6 months, but that appointment's in the books. And then keep that appointment every year. That way it's always on the calendar, it never changes. That way you're getting regular blood work, you're making sure you're getting health screened, and that's overall going to lead to better health outcomes over time.